Hi, everyone. This is Andrew Cutler with a brief message about changes at the NEI podcast. Our host, Sabrina Segal, is moving on to an exciting position in the field of TMS research, and we couldn't be happier for her. So what does that mean for NEI podcast? Well, we'll be taking a temporary hiatus over the summer. From July through September, we will revisit some of our most compelling episodes on topics that remain as relevant today as when they first aired. New episodes will resume in the fall, so make sure you're subscribed so that you don't miss out. This summer, NEI Podcast is revisiting some of our most compelling episodes. In today's re-release, Dr. Sabrina Segal interviews addiction expert Dr. Nzinga Harrison about the need to address stigma and misconceptions surrounding the topic of addiction. Importantly, Dr. Harrison shares a refreshing perspective on the concept of recovery, a fitting topic this month as it is National Recovery Month.
I'm Dr. Sabrina Segal with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, we are speaking about recovery with addiction expert Dr. Nzinga Harrison. September is National Recovery Month, and it is my privilege to interview Dr. Harrison, who has her own podcast called In Recovery. Dr. Harrison, if I may introduce you the way you introduce yourself on your podcast, Dr. Harrison is a doctor, psychiatrist, addiction expert, mom, wife, and human. Welcome, Dr. Harrison.
Thank you so much. That was great.
Dr. Harrison, what is your view on addiction and how does it differ from the mainstream way of thinking about it?
Oh, okay. Thank you for opening with this question. I would say the way my view of addiction differs from the mainstream first is that addiction is a chronic medical illness. And I think if you talk to people who practice addiction medicine or who practice addiction psychiatry, that will be a very commonly known fact. But if you just talk to people kind of in the general public who are not kind of in this space professionally, then often people think of addiction as a series of choices, a series of bad choices, a personality issue. So one of the most common questions I get is like, does this person have an addictive personality or a moral failing? And so I think the very first, most important is that addiction is a chronic medical illness. And then the second part that I'll just emphasize about that is really that word chronic, which is like high blood pressure, like diabetes, like asthma. You will hear folks say like, oh, that person used to be an alcoholic or that person used to, quote, be an addict. And the way you really have to think about it is not in the first place that that person is or was, but that that person has an illness. So that person has alcoholism or that person has addiction. And also that just because that alcoholism is in remission right now doesn't mean they don't still have it. Or just because that addiction is in remission right now doesn't mean they don't still have it. The same way when your blood sugar is controlled doesn't mean you don't have diabetes.
Right. I love that. What are your thoughts on the current treatment approaches for addiction? Because there's quite a lot out there now. What can you tell us about that?
So I could take you down a lifelong rabbit hole of my thoughts about current treatment approaches. So I'll mention here that I'm co-founder and chief medical officer of Eleanor Health. And at Eleanor Health, one of the biggest things that we're trying to turn on the head is the way we treat people with addiction. And so many of the current treatment approaches are quite frankly punitive and lacking in compassion.
Oh, yeah.
And what we know is that any animal, human beings included, when you're hurting, when you're sick, when you're vulnerable, the number one thing you need is compassion. And the number one thing you do not need is judgment and a punitive approach. And so part of that comes out of how I was answering the first question, which is the stigma that we have against people who develop the disease of addiction. And part of it also goes back to my emphasis on that word chronic. And so many of the current treatment approaches are born out of this, I'll call it erroneous idea that the only way to get to recovery is through complete and utter abstinence. And if a person is not able to reach complete and utter abstinence, then somehow they are not worthy of receiving treatment for that addiction.
Right.
And I think the other mistake that current treatment approaches are making, so that's the first one, is just like complete and utter abstinence or bust. The other mistake is this idea that treatment is somehow short term. So that goes back to what I was saying about addictions being chronic medical illnesses, which means you have to be working on those illnesses at every phase. So when when your blood sugar is so high that you have to be in the ICU, ICU is the right phase of care for that. But when you get discharged from the ICU, nobody discharges you from the hospital without insulin and says, and good luck staying alive. It's not the way it works. And even when your blood sugar is like well controlled and your diabetes is firing on all cylinders, like your A1C is low and your oral medication is stable and your diet and exercise is great and your stress is low, you are still periodically checking in with your physician to make sure that diabetes stays in remission. And so we have to get that same concept for addiction. Like, yes, you may need a 5-day detox, and that's the appropriate level of care. You're not done. When you get discharged from the hospital, I want everybody to have been talked to about the medications that we have that work, the psychological interventions we have that work, the importance of reducing stress, the importance of relapse prevention. And even when you're 5, 8, 10 years in recovery, you still have to be working on all of those factors that help that substance use disorder get in remission in the first place, or else a relapse will come. And so it's that longitudinal support and compassion and working what I call that magic formula to keep that illness in remission that I think is missing from many current treatment approaches.
Wow. I love your take on this. And I think that is so important. And it's interesting when we talk about addiction, it is a mental health condition. And I think it's great that we've gotten to the point where we can talk about things like depression as being, a chronic condition. And we can actually talk about it in much the same way you would talk about addiction from a medical standpoint or a healthy standpoint, in saying, right now this person is in remission from depression. We can talk about depression that way. So it's interesting that it seems as if, there's still so much stigma around the concept of addiction, and people still struggle so much with treating it as a mental health condition. Would you be willing to share with us a little bit? You said something about those 5 factors. Can you share that with us? And that sort of leads into my next question, which is, what does it mean to say that someone is in recovery? Because, just like there's so much stigma out there about addiction and what that means, I think that when someone mentions the word recovery, there's a lot of misconceptions about that and misunderstandings about that. So could you elaborate a little bit more on that?
Yeah, definitely. So I'll start with what I call the 5 components of a magic formula for any health condition, addiction and substance use disorders included. And so the first is biological. What we know is that illnesses or disease develop for biological reasons. And those biological reasons can be inherited, or they can be what we call acquired, meaning you got it at some point along in your life. So for example, if we're talking about an opioid addiction, we know just like blood pressure, diabetes, asthma, high cholesterol, that addiction runs in families because it is coded for in your DNA as high as 40% of your risk is coded in your DNA for developing an addiction. And so that would be the inherited part. And the way we manage that, so I have a significant amount of addiction in my family, addiction and other mental health conditions also. And so like I'm already having that conversation with my kids. My kids are 13 and 15. And from the time they were 3 and 4 years old, it's like, just like you have inherited risk for high blood pressure, so we have to be maybe more careful about how much salt we're eating than other people do, you have inherited risk for schizophrenia. So your friends may be able to smoke marijuana and you might smoke marijuana and develop psychosis. You have increased risk for cocaine addiction. So when you get to college, your friends might be able to do a couple of lines and be fine. And you might do a couple of lines and it turns into a whole substance use disorder because of your DNA. Right. And so that knowing that genetic risk kind of allows you to practice prevention for that inherited biological risk. An acquired biological risk, meaning you got it at some point in your life for an opioid use disorder, would be like getting in a car accident and having a back injury and getting prescribed pain meds. You weren't born with that back injury, but that back injury is a biological risk factor to your now developing an addiction to pain meds. And so because we know the illness develops for biological reasons and gets worse for biological reasons, then part of the magic formula has to be biological interventions. So that might be, avoiding narcotic pain meds. That might be getting an antidepressant if there's a depression going on. That might be making sure your diabetes is controlled because low blood sugar feels like alcohol withdrawal and triggers cravings for alcohol. All of that's in the biological realm. The second bucket for the magic formula comes from the second bucket for how disease develops, which is psychological. And so this is based on all of our experiences from the moment we pop ourselves out of the womb, our childhood experiences, our adolescent experiences, our adult and ongoing adult. We form this view of the world. And then the way the brain works is that it takes all of the information you're getting every day and nests it inside your view of the world. And so we have to, this is children who experienced abuse and neglect, adults who experience trauma. We have to be dealing with all of those psychological factors. And the example that I use for this is like a diabetes example. When an 11-year-old gets diagnosed with type 1 diabetes and you say, when all of your friends are going out for pizza and soda, you can't eat pizza and soda. That is a huge psychological burden that has the ability to drive that diabetes off the cliff. Because for an adolescent, eating pizza and drinking soda with my friends is more important than controlling my blood sugar. And so we have to be able to address those psychological factors. I could tell a similar story for addiction and substance use disorder.
Okay.
The third bucket for the magic formula comes from the third bucket for how disease develops, which is social and stress. And so what we know is that all of the stressors we experience early in our lifetimes, so starting from adverse childhood experiences, the audience may have heard of ACEs, all the way through just like the daily cumulative stress that we use from being overscheduled, not having enough time, having financial stressors, having relationship stressors. All of those drive biological and psychological signals in our bodies that create disease. And so I cannot ask a person to not drink alcohol when housing is unstable and creating so much stress and so much anxiety and so much fear signal, or when the marriage is on the rocks and divorce is impending and your brain is telling you the only way to deal with the hurt and the pain and the stress of that is to drink. We have to address those things.
Right.
The fourth and fifth buckets I will put together. I call them cultural political. And so our identities, our ethnic identities, our racial identities, our gender identities, our cultural identities are so extremely important. And the reason I can't divorce this from political is because at least in the United States of America, but to some extent in all cultures, we marginalize people for who they are. So we marginalize people for being women. We marginalize people for being transgender. We marginalize people for being Black. We marginalize people for being Jewish, for being short, for, different abilities.
Right.
And so part of health as humans is belonging. And so if we don't address that sense of life purpose and belonging, we're not just driving addiction, we're driving all the rest of those chronic medical illnesses also. And so when we're thinking about the magic formula, and I know this is the longest answer ever,
I love it.
when we think about the magic formula, and then I'm going to roll straight into your question about recovery, it has to be biological, psychological, social, cultural, and political. And that's the answer to recovery. People think when you say that person is in recovery for addiction, that the singular definition of that is that they're no longer using the substance they were addicted to.
Right. Yep. Absolutely.
That cannot be the definition, because if the only thing I'm looking at is whether or not they're using, I'm completely thwarting my responsibility to help that person have a biological recovery, a psychological recovery, a cultural identity recovery, and a political recovery, which is about connectedness and life meaning. And if I'm ignoring those 4 buckets, then guess what's coming? Relapse.
Yeah. Wow. Well, that's one of the most phenomenal answers I've ever heard on this topic. And I'm so glad that you addressed that. And I think you mentioned in your podcast that and correct me if I'm wrong, up to 90% of Americans have some form of addiction. Is that a correct estimate?
And so that's if we broaden this definition of addiction. Basically, the idea of that is that it's all of us, because that's the other thing that's driving stigma on addiction in this country, is like somehow we think those people have it and we don't, but it's really all of us.
Yeah. And I know exactly what you mean when, you hear people use that label like, oh, he's an addict or she's an addict. And it's incredibly stigmatizing, and my response to that has always been, well, aren't we all capable of addiction at some point?
That's right.
And so it's very interesting. So speaking about your podcast, could you tell us a little bit more about your In Recovery podcast? What was the reason for launching this podcast, and what can you tell us about how it has been received? Because I love it. I'm so excited about it. I've been subscribed. And, some of the things I can say about this podcast, just putting it out there for our listeners or anyone who's interested, is that you are so real in your approach to addiction. You are a medical expert, but you are so down to earth in your approach. And I feel like the show just has so much compassion. And I listened to an episode where you did some role playing, and the role playing seemed so authentic. I couldn't believe that you were role playing. It was amazing. It was incredible. So just putting that out there.
Oh, so I'm so glad that you're loving it, because I am also loving it. So to talk about the origin story of In Recovery, you and your listeners may have heard of Lemonada Media, and they did this phenomenal podcast series called Last Day on the opioid epidemic. And so I actually came to Last Day as an expert to talk about treatment for opioid use disorder, and made such like an intense, just immediate connection with Steph and Jess over at Lemonada Media. And Last Day was always conceptualized to be a finite series, like things that are killing us. And it would be on this topic with a series of episodes, and then move to the next topic with a series of episodes. And so the opioid epidemic was always conceived to be a time limited series of episodes for Last Day. And they just built this audience that it was so clear to Lemonada Media, they did not want to leave this audience hanging with no more resource and no more connection. And so they asked if I would host the follow-on podcast, which is In Recovery. And so we started In Recovery, and the reception has just been overwhelming. Like, it's a question and answer podcast. And so we ask people to share kind of like the most vulnerable parts of their experiences that you would typically be judged for and marginalized for and stigmatized for, so that we can bring those stories to the podcast so that our listeners can know you're not alone. Like, you're not the only one going through this. And this is how we can make it easier. And this is what the evidence says. And these are the questions you can ask when you go see a medical provider to make sure that you're like, to increase the chance that you or your loved one will be able to get what you need. So it's been an incredible experience.
That's wonderful. I love it. Now, I know you mentioned that you are the co-founder and the chief medical officer of Eleanor Health. Can you tell us more about this organization and how they can help people with addiction? And I have a follow-up question to that, which is, what is the relapse prevention plan that was created out of response to the COVID stimulus check? I thought that was so interesting when I came across that.
Yeah, so you have been on Eleanor Health's website
Yes,
to know about that relapse prevention plan. So interestingly, and I should add this into the story for In Recovery, the reason I was linked to Lemonada Media as an expert was because Lemonada Media is linked to one of Eleanor Health's board of director members, who is Andy Slavitt. And I'm the co-founder and chief medical officer. And Andy said, Lemonada is looking for an expert. And of course, I floated your name. And I was like, great. And so Eleanor Health and In Recovery are kind of inextricably linked in that way. So Eleanor Health, we are an addiction treatment provider. We take care of people right now in North Carolina and New Jersey, even though I'm happy to say we'll be coming to more states very soon by the end of this year and next year. And
great.
We started Eleanor Health kind of related to the two questions that you asked me at the beginning, which is, how do we think about addiction differently? Number one, at Eleanor Health, we know that the relationship creates all opportunities for health, period. That's in addiction and that's outside of addiction. And so we defined ourselves differently from other abstinence-based addiction treatment providers in that there will never be anything punitive about your experience at Eleanor Health. There should never be anything degrading. There should never be anything marginalizing. Every single interaction that any person has with Eleanor Health should feel like a warm hug, period. Like, we are putting our arms around you, and we take care of addiction at every single phase of the illness. So still using, come to us. We can support you. We can reduce the risk of you dying. Still, in early remission, just figuring out what recovery means for you, come to us, join our community, let us join your community. We can help you figure that out and put support in place for helping you define what those 5 pieces of your magic formula are. In sustained remission, please come to us. Help us learn how you stayed in recovery so that we can share that with the rest of the community and support you in staying there. Your illness had a relapse, and this is like Eleanor in Greek means shining light. This is one of the reasons we named ourselves Eleanor Health. Like, you feel like you're in the dark, we want to be that beacon of light that is just always shining. When you can't find hope for yourself, let us hold the hope for you. Like, come to us. And so we created Eleanor Health kind of to like be with people on the entire journey without judgment and with warm, embracing arms every step of the way.
I love that. That's amazing.
The relapse prevention plan is because we know that money is a huge trigger. Mm-hmm. Money is a huge trigger for relapse of a substance use disorder. And so as soon as we found that COVID stimulus check was going to come out, that was amazing, because what also is a huge trigger is losing your job, or not knowing how you're going to pay the bills, or not knowing how you're going to buy groceries. So we knew, though, that those stimulus checks could be a double-edged sword for the people in our community. And we actually call people who come to us for services, we call them community members, because we're like building our community. Not you're getting admitted to treatment, not you're a patient. Like, you are a person that we value, that we care about, who is in our community. And so we actually developed with each and every one of our community members, like, do you think when this money deposits in your bank account that that's going to be a trigger? Because if so, let's develop a safety plan around it, practice an ounce of prevention. And then as we were doing that, we said, you know what? People who are not in our community might also benefit from this. And so we wrote a whole blog and just put it as a resource for free out to the public for anybody who might be able to benefit.
That's wonderful. I love it. Love it. Let's talk just for a minute about alcohol addiction. Can you share with us how this addiction might differ from other types of addictions? When I think of alcohol versus other substances, not to minimize addictions to other substances, but alcohol is something that is considered so much of our culture, in society, and it's used for celebrations and also, to kind of commiserate with each other. It just seems like it's everywhere, and that it's a very different type of a substance than something that you don't necessarily see when you're walking down the street, on a billboard. So how is alcohol addiction different? And can you share with us just kind of your view on that addiction?
Absolutely. So you've put your finger exactly on it, which is that one of the things that makes alcohol so dangerous in this country is that it is so firmly embedded as part of our cultural existence. Alcohol use is celebrated. We start raising our kids from the very beginning with anticipation of turning 21 so that you can drink, right? So that you can drink legally. Every movie we see is like partying and alcohol, like to have a good time. Alcohol must be there. We actually ostracize people who don't drink for whatever reason. And so all of those make it incredibly dangerous, because the more embraced a substance is, the harder it is to recognize when there's a problem with that substance. And so I'll just drop a couple of statistics here, which is that whenever we think of death from addiction these days, we think of the opioid crisis and overdose deaths from opioids. But the number one substance in this country that is killing people is cigarettes, tobacco. And the number two substance that is killing people in this country is alcohol. Wow. And part of the reason it's difficult to know that is because alcohol is a long, insidious death, whereas opioids kill you tonight. And so it's much easier to kind of make that connection, like heroin killed my brother, because my brother was here yesterday and my brother is not here today. Alcohol is also killing our loved ones. It's just happening over 20, 25, 30 years, unless it's like a drunk driving accident. People can kind of make that connection very quickly. And so if we look at alcohol use disorders in this country, I think your listeners might be surprised to know that 80% in COVID especially, but as many as 80% of people are qualifying for risky drinking. And part of risky drinking is binge drinking, which if you have drunk more than 4 drinks in one setting, you're binge drinking. And 4 drinks is 4 ounces of wine. That's one drink. One 12-ounce beer is one drink. One 1-ounce shot of liquor. So if you say make it a double or a triple, you're literally 3 drinks into that 4 drinks for a woman is 5 drinks for a man. And the reason we define binge drinking at 4 drinks in a setting for a woman, 5 drinks for a man is because if you do that more than once a month, we literally can point directly to the physical and psychological negative consequences that come from that level of drinking. It takes a toll on health. And so when we're looking at our college kids that are binge drinking every weekend, it's dangerous. When we're looking at our CEOs that are having 2 stiff drinks every night after work, that's binge drinking potentially every day of the week. And so we conjure up this idea of the quote alcoholic, which is the homeless person with a bottle in a brown bag begging for money on the side of the street, when in reality, a huge portion of people in the United States are qualifying for a diagnosis of mild alcohol use disorder or even moderate alcohol use disorder in any given moment.
Right. Absolutely. I'm so glad that you addressed that, because I think that's so true. And that there's so many people who just try to kind of qualify it, and they say, well, it's just at night I have some wine, it helps me sleep. And that, eventually they're losing track of how many drinks that is. And again, they don't think that they necessarily fit that description, because again, it is the stigma and this kind of misunderstanding that we have of it.
Yeah. And to just drive that one more, like when you say, you look on social media and you say it's wine o'clock somewhere,
right?
It's 5 o'clock somewhere. All of this is making it okay to drink, but you would not see on social media, it's heroin o'clock somewhere.
Exactly.
You would never see that going viral.
Yeah, you don't go and sit down at a restaurant and the first thing they do is offer you different types of cocaine.
Right, exactly. Like, here's our cocaine menu. Yeah, would you like it IV, powder? Like, you would never see that.
Yeah. So what, in your opinion, is the best approach to addiction? Would you say it's abstinence? Would you say it's harm reduction? There's so many different viewpoints on this, and I'm just really curious to hear what your thoughts are.
Yeah, I would say the answer is yes. Mm-hmm. The best approach is abstinence. The best approach is harm reduction. This has to be a completely individual discussion, not just for each individual, but also at each point in time. So I can take care of a person today and they may say, I have to be completely abstinent from alcohol because of the severity of my illness. And it may be that 10 years from now, that same person might say, I'm taking a harm reduction approach to my alcohol use, which means I can't drink more than 2 drinks a week. And the harm reduction approach might be the right approach 10 years from now, even though the abstinence-based approach is the right approach today. And the other thing is that has to go by substance. And so it may be that complete abstinence from heroin is the right approach, complete abstinence from cigarettes is the right approach, but harm reduction for alcohol and marijuana is the right approach. What I will say is that harm reduction is always the right approach. Abstinence is not always the right approach. And so this goes back to our fundamental belief at Eleanor Health that the relationship creates all opportunity for health. And so never, capital letters, bold, underscore, italics, 3 exclamation points, never is the right answer when somebody reaches out for help. Never is the right answer. No, never, period, ever. Do I sound convincing? And is my conviction showing through? The answer when a person reaches out for help, the right answer is never no. And in that way, harm reduction is always the right approach, because the right answer is always, how can I help you reduce your harm today?
Okay. Wow. I love that.
Yeah. And so a person may come to me, if a person comes to me and says, I want complete and utter abstinence, the right answer there also is not no. It's like, okay, how do we get you to complete and utter abstinence?
Right. Okay.
If the person comes to me and says, I only want to stop blank, or I just want to reduce blank, I don't want to stop it completely, but I'm also still going to use ecstasy on the weekend with my friends, the right answer is not no. The right answer is like, okay, and so how can we reduce the harm to you as quickly as possible?
Right. Love it. What are your views on medication-assisted therapy, or MAT, or other pharmacological treatments for addictions?
I have the same answer that I had to the previous question, which is yes.
Okay.
So to go more broadly about that, I actually almost cut medication-assisted therapy as a term out of my own personal vocabulary, because I don't appreciate the message that it sends that somehow medication is not a needed foundational biological intervention for it.
Mm-hmm.
And
Okay.
I was talking to this family practice doc who helped me take a wider view of that, which I really appreciated. And she said, but whenever we prescribe a medication for any illness, isn't it always just medication assisted therapy? Because the treatment for any illness will never only be the medication.
Right.
And she took me to church. I was like, hallelujah, amen, yes. And so that is my view on medication-assisted therapy or medication pharmacological treatment for addiction, because that is my view on medication-assisted therapy and pharmacological treatment for any illness. Insulin will never be the treatment for diabetes.
Right.
Albuterol will never be the treatment for asthma. Suboxone or buprenorphine will never be the treatment for opioid use disorder. But in all of those cases, do we have the data that says insulin increases the chances that your diabetes will stay in remission? Yes, we do. So should that be a consideration for every single person that walks in the door with diabetes? Yes, it should be a consideration. Now, their individual disease state and life factors determine whether insulin is the choice that we make. But should insulin be on the menu for, as soon as I hear diabetes, should insulin be one of the things I consider? Yes. As soon as I hear opioid use disorder, should buprenorphine, Suboxone, Vivitrol, Methadone, those are the FDA approved medications that we have for opioid use disorder. Should those be part of my consideration? As soon as I hear opioid use disorder? Yes. As soon as I hear alcohol use disorder, should Vivitrol, Camprol, Topamax, naltrexone, should those be part of my consideration? Yes. As soon as I hear tobacco use disorder, should Chantix, Wellbutrin, nicotine gum, nicotine patch? Yes. But is it the answer?
Right.
No. It is part of, it is one of those buckets of the 5 buckets that make up the magic formula.
Yeah.
The problem is, for so many treatment providers, it's not even on the table. And that is not practicing standard of care in medicine. That is outside the evidence base. It's in my opinion, is malpractice.
What are some behavioral addictions that most people don't think about? I was waiting to get to this question because I know you address this in your show.
Yes. So in recovery, we address all addictions. And the definition of addiction that we use is any behavior that we continue despite negative consequences.
Right.
With, very importantly, humans don't continue behaviors that are not bringing positive consequences. And so some of, when you think of behavioral addictions, people will think of porn, people will think of gambling, people will think of sex, but people might not think of exercise.
Right.
People might not think of work. People might not think of technology, screens, internet addiction. And so all of those, literally to the point that we have like scales where you can see, am I at risk for technology addiction? Am I at risk for work addiction? Am I at risk for exercise addiction? There are scales that exist for these because, yes, we work despite negative consequences. Now, it is also bringing positive consequences, which is like paycheck and then also value, right? Like we value people that work a lot. Yes, exercise can be an addiction to the point of literally like needing surgery, alienating your family, developing, like low weight. But does it bring value? Yeah, because as a country, we value exercise. And so I really just encourage everybody to look at what is something you have thought to yourself like, oh man, this is causing me problems. And yet you continue to do it. Then welcome to join all of us that are dealing with some sort of addiction.
And now that leads me to my next question, which you've also mentioned on your show, and I love this. You mentioned that people might be addicted to chaos. Can you share your thoughts on this?
Totally. And so, and I'll say the other side of that, some people are addicted to chaos and some of us are addicted to order. And we can actually, like, we can abuse chaos in a way that is not good for us and the people around us. And we can abuse order in the same way. And so a lot of it, remember I said when I talked about the biological, psychological, social, cultural, political inputs to health, really a lot of this, some of it is biologically defined. Like you can tell infants are born and some infants can thrive amidst chaos and other infants really struggle and need things to be in order. So part of it is just like the way your brain is programmed, but a big part of it is also our brain is constantly forming its electrical and chemical processes in reaction to what is happening in our lives. And so if we're reared in chaotic settings, we develop chaotic physiology. And so when chaos is missing, your brain and your body actually feels like it feels that missing piece and goes in search of it, not necessarily consciously. The same is true if you are reared in like just a very hardcore, orderly environment, then when that order is missing, you will actually develop withdrawal, physiological, psychological, emotional withdrawal for that order. And even unintentionally, you will go seeking out that order. And so it's the same way our other addictions develop, which is always just like that deep brain survival system, that dopamine system looking to keep us safe. And when there's any kind of like danger or threat, and that can be all kinds of things, that can be emotions, that can be physical, that can be safety, that can be identity, integrity. When there are threats that exist, that survival pathway will find something that resolves that threat. And it could be any number of behaviors or substances.
Wow. That's fascinating. Now, I know we talked a little bit about sort of what could be considered healthy addictions. Would you say that there are any healthy addictions that exist? Could these ever be used as sort of replacement strategies for unhealthy behaviors, or are all addictions bad?
The term healthy addiction is an oxymoron because the definition that we're using for addiction is negative consequences, like it is causing you harm. And so if it is causing you harm, it is not healthy. But I will answer your question this way, which is like, are there some behaviors that can be addiction? Yes. That when in moderation, we can use as replacement behaviors to treat another addiction.
Okay.
Yes.
Okay.
And so exercise for one person may be an addiction. For that same person, if we can figure out what the root cause is, so what is the danger that's driving the need to use exercise as an addiction? Can we address that root cause and then have exercise be actually a positive behavior, replacement behavior in that person's life? Yes.
That's amazing.
But you have to get to the root cause.
Right. As my final question, I'd like to ask you, what are some final thoughts on recovery that you'd like to share with our listeners?
I would say the final thought that I want to leave people with for recovery is remembering that recovery equals connection. So I saw this beautiful quote, and I wish I could pull out the person's name, but it's not in my brain. But he is a person in recovery, and he said, addiction is the epitome of disconnection. And so it follows that the treatment for recovery is connection. And that's what I would like to leave your listeners with. If you are a person with addiction of any sort, seek to get connected. I always say, if you're a person that needs help, take the risk, despite I know the stigma and the barriers and the marginalization. And I know this is a tall ask, but if you're a person with addiction, take the risk to ask for help and get connected. And the resource that I'll drop there, again, like Eleanor Health, even though we're right now in New Jersey and North Carolina in terms of you being able to join our treatment community, we have free online support groups for anybody, anywhere in the world. No commitment, no requirements, just support. And so just go to the website, eleanorhealth.com, take the risk to ask for help, to start that connection. And then the other thing I say is if you're a person who's in a position to help, take the risk to offer that opportunity for connection to somebody in need. Because the definition of recovery, and this is for all illnesses, not just addiction, is connection.
Wow. I love that. Thank you so much, Dr. Harrison. Thank you for being on our show.
Thank you for having me. I loved it.
This episode has been brought to you by the NEI Podcast. With nearly 100 episodes, you can find us on iTunes, iHeartRadio, Libsyn, and virtually any platform that you prefer to listen to podcasts. If you've enjoyed this episode, we ask that you kindly leave a review for us. Go to any of the platforms mentioned and leave a star rating or a comment. We'd love to hear from you.